So after you've had a concussion, it's important to rest for a couple of days and allow your symptoms to come down and stabilize. First few days, we recommend what's called relative rest. That is, taking it easy and just not doing anything that aggravates your symptoms too much. Once your symptoms have stabilized, you can start to become active. Again, by identifying the threshold where your symptoms go up and then staying below that. In terms of exercise, there are a couple of ways to approach that. If you're not a high school or college athlete or a professional athlete and you just want to start doing something more, you can start to do something very light, maybe a stationary bike or walking, and um, and just um, go at a very light level until you start to feel an increase in your symptoms. That might be headache or might be dizziness, depending on what you feel, and compare that to where you were when you started. And if your symptom level has gone up by about 2 points, let's say, compared to where you started, you should probably stop at that point. And then every day you can try to advance that a little bit according to your symptom tolerance. And generally what we find is that your symptom tolerance improves over time. For athletes, the best way to approach this program is to identify that specific exercise intensity at which your symptoms increase. Now we do that one of two ways generally. The first way would be on a treadmill, and we have a test called the Buffalo Concussion Treadmill test that is meant to identify the specific heart rate at which your symptoms go up, and we then give you an exercise prescription to exercise at a high percentage of that heart rate. But theoretically, it's at a heart rate where you weren't getting symptoms, so that's safe for you to do. We also have a bike test that we've developed over the past couple of years that mimics the metabolic demand of the treadmill test and gives us very similar information, but it's on a bike instead of walking or running on a treadmill. And then we advance the exercise program according to your symptoms. College could actually retest the athlete every couple of days even and see where that threshold is on retesting and advance the exercise prescription that for the non-training athlete, the primary care patient, or you can do it in a more systematic, sort of scientific way if you are a high school athlete, college athlete, highly trained athlete, and you want a very specific prescription to help you recover from your concussion.